Hello, and welcome to the official and virtual ribbon-cutting ceremony of the Thomas W. Huebner Medical Office Building. I'm Claudio Fort, President and CEO of Rutland Regional Medical Center, and we are happy that we have been able to celebrate this major milestone and to do so in a way that is safe during the COVID-19 pandemic. We will hear from a few people in a bit, but first I'd like to start things off by sending out some thanks and recognitions to the people who have worked tirelessly to ensure this building was completed to everyone's satisfaction, and I'm happy to say, on budget. Thanks to our Board of Directors, Tom Hubner, physician and administrative leadership for their vision for the medical office building and their commitment to the healthcare needs of our community. Thanks to our state and local officials and the Rutland County delegation for their support throughout this project planning and completion. Thanks to our financial partners, USDA Rural Development, Echo Financial Services, and TD Bank, and our principal partners, architect LaValle Brenzinger, construction manager HP Cummings, as well as Artisan Engineering, Krebs and Lansing Engineers, Ellen Consulting, and the many local subcontractors who did a tremendous job on this project under the difficult conditions caused by COVID-19. Special thanks to our CFO, Judy Fox, for securing the necessary financing, and to our Vice President of Support Services, Jim Greeno, for his outstanding dedication for planning and oversight of this project, and to every member of his team. And to our administrative team, Jonathan Reynolds, Tom Frank, Elizabeth Cahill, the VOC and ENT Audiology physicians, Mel Boynton, David Charnock, and Mike Kanash, and to their team leaders. Building a building during a pandemic, no less, takes a lot of teamwork, dedication, and patience, and I am so very proud to have inherited such a dedicated team of people who all worked together so well to make this building a reality. Now we are going to hear from Joe Kraus, Chair of the Rutland Regional Medical Center Board of Directors.
On behalf of the hospital's Board of Directors, I am happy to be a part of the dedication of the Thomas W. Huebner Medical Office Building. Last April, we broke ground on this building with the expectation that it would be completed in June of this year without incident. Then COVID intervened and work stopped, while the hospital devoted all of its resources to taking care of us. The logistical, clinical, and financial challenges were enormous. In fact, this was a challenge of the scale and magnitude that our hospital had never before experienced. Nonetheless, the hospital rose to the occasion. Our doctors, nurses, support personnel, and administrators responded quickly and efficiently in the face of great uncertainty and significant personal risk. It was selfless leadership at its best. And through it all, they managed to build this wonderful investment in our future. This building will forever be a testament to the man it is named after, Tom Hubner. It will also be a testament to the dedication, strength, and ingenuity of our 1,600 employees who have kept us safe and well cared for during these most trying of times. I would particularly like to acknowledge the work of Jim Greeno, who oversaw the design and construction of the building, which was completed on its adjusted schedule and at the originally negotiated price. Judy Fox, who arranged the financing of the building on highly favorable terms, and who preserved that financing in the face of overwhelming financial insecurity. And Claudio Fort, who led us through it all with strength, confidence, and humility. Thank you.
Next, we are going to officially open the Thomas W. Huebner Medical Office Building with a ribbon-cutting event with some of the people who helped to make this building come to life, as well as the physicians, advanced practice clinicians, nurses, and support staff from the Vermont Orthopaedic Clinic and the ENT and Audiology service. Next, we're going to have a virtual tour of the building led by doctors Mel Boynton from the Vermont Orthopaedic Clinic and David Charnock from ENT and Audiology.
I'm Dr. Mel Boynton, Medical Director of Vermont Orthopaedic Clinic. We're here at our new medical office building that we're really excited about. Some of the outdoor design features that we're really thrilled about are our parking that's very convenient, and our overhanging roof that allows easy drive-up protection from the elements on the way into the building. That being said, let's go on inside and take a look. Welcome to the nice warm foyer. The elevators will take you up to ENT Audiology. Let's go on inside to Vermont Orthopaedic Clinic. When you enter, you are greeted by a warm, inviting, open space with lots of natural light. Our registration area is spacious with plenty of room, which is important as many of our patients use crutches, walkers, or wheelchairs. After check-in, our patients are invited to sit in our spacious and bright waiting area until a medical assistant escorts them to their appointment. The practice space is divided into two sides, if you will. Orthopedics on one side, and spine care and physical medicine and rehabilitation on the other. Being together in the same space allows our physicians to consult immediately with each other and help support our team approach to patient care. This is our patient care area. Here again you will see an abundance of natural light with a crisp, modern feel to give the sense that the patient is in the right place to be cared for. And we have nice wide hallways. In our old space, only one person could pass through the halls at a time. Here we have room for everyone. Having this space is much quieter for patients and safer, as we are less likely to bump into each other or trip over things. Our exam rooms are set up for maximum efficiency and patient flow, with plenty of room for the patient and their essential support person, as well as the provider. Each room has an electronic adjustable bed, so the patient no longer needs to use a step stool, a major improvement. At the top of each hallway is a team room. Here we consult with others on the team to get opinions on an MRI or an X-ray. And here the team rooms are connected with doors on each side, so you can walk through from one team room to the other to get information quickly. Finally, we have 3 X-ray suites. These are very high-tech, low-radiation machines, and they require a lot of maintenance. Having 3 X-ray machines shortens patient wait times, and in many cases eliminates the need for a patient to make a second trip back for their X-ray. We typically do 100 to 150 exams a day, and we need 3 X-ray machines in order to do that. Thank you for taking this tour of Vermont Orthopaedic Clinic. Now Dr. Charnock is going to show you ENT and Audiology.
Hi, my name is David Charnock, Clinical Director of the ENT and Audiology Division here at Rutland Regional Medical Center. And I would like to welcome you to our new medical facility, the Thomas W. Huebner Medical Office Building. Here on the second floor, we have the Division of Otolaryngology, Head and Neck Surgery, Hearing and Balance Center. As you can see, the elevators on my side open up to a beautiful, splendid view of our mountains to the west. And I'd like to take you on a tour of our new facility that we're very proud of. The light continues into our open and inviting patient reception area with a registration area directly in front. For your privacy, the check-in and check-out have deflector walls between each of them. To one side of our waiting area is a special children's area for our many pediatric patients. This is a kid and parent-friendly space with its own bathroom. Post-COVID, we will have interactive toys and books here. The layout is such that noise is contained within the space, but parents can watch their children through this glass divider. The practice has 2 areas, one on each side. First for the ear, nose, and throat otolaryngology practice, and the other side for audiology balance service. Both have multiple exam rooms, double what we had before, which is great to accommodate patients and providers for better access to our specialized care. And each has its own separate HEPA air filtration system to reduce respiratory viruses, so important for patient safety. Let's check out Audiology Balance Center first. Here is where we have 2 state-of-the-art audiology testing booths. They designed the building around these booths and actually moved beams to make these large sound booths accessible to patients, and they sunk the floors down so patients in wheelchairs can be accommodated. These are the largest audio booths in the state to our knowledge. They are kid-friendly with plenty of room for a support person or parent. We are fortunate to have an audiology tech with a retail space where hearing aids are fixed, adjusted, and fitted to the patient. We also have loaner hearing aids so patients can go on with their lives while they wait for their own set to be returned. Here is our vestibular balance lab, where we work with patients having balance issues. We outfit the patient with special goggles and a sound-canceling earphones. We sit them down in the dark and introduce various light stimuli to measure and coordinate the activities of their brain, their eyes, and their inner ear to help make a diagnosis and help them with treatment. The specialized exam chair is equipped to help stabilize patients who may feel like they are spinning. This is our allergy section of our practice, where we test and treat inhalant allergies. We observe and evaluate patients for symptoms. We also do sublingual immunotherapy allergy drops, which is very innovative and convenient for patients. Instead of multiple allergy shots, we use an allergy drop placed under the tongue, which the patient can do at home and no longer come into the office every week for shots. We are also thrilled with our new large sterile processing area where we sterilize all our equipment. Before it was in a very small space. Now we have this large area to clean instruments faster and is designed specifically for our office procedures. Let's move to our larger treatment exam rooms. This is where we perform procedures with higher level equipment like endoscopes, microscopes, high-definition cameras, video analysis, and swallowing analysis. These help see the inner workings of the ears, nose, sinus, throat, and mouth. Each treatment room has specialized carts and is set up so we can work with the patient from either side of the exam chair. This is a high-definition camera for microsurgery and has the ability to record and send pictures for the patient. This is our nurses' team area, and over here are the doctor's offices, the physician assistant workroom, and our triage and referral nurses. We also have our surgical scheduler and clinical manager here. All of us are in the same area now. This supports our team approach to patient-centered point of care. So there you have it. Our new ENT and audiology space helps us to see more patients and have access to more providers. All of this translates to better and more efficient patient care, which is what it's all about. Thanks for taking the tour. We are looking forward to continuing to provide exceptional ENT and audiology services for our community and beyond for many years to come.
And next, we are going to hear from a few special guests.
These are challenging times, but this is a great day. The ribbon cutting of the Hubner wing at the Rutland Regional Medical Center. Tom, congratulations for all your work. We're really grateful to you in the role you played in building this institution to be the community servant that it is. And to Claudio Fort and the entire team at Rutland Regional Medical Center, thanks so much for weathering this COVID storm. We have a ways to go, but you are helping us get through it. What a vital service that you provide. And our hope is that we will be able to continue supporting you in Washington so that you have the resources you need to continue providing the services that Vermonters need at this great, great institution, the Rutland Regional Medical Center. Thank you and good luck.
I want to congratulate everyone at Rutland Regional Medical Center on the opening of the Thomas W. Huebner Medical Office Building. This new facility reflects the vision of the hospital's board of directors, administrators, and staff, as well as the vision of its namesake, former president and CEO, Tom Hubner. I pulled Tom out of retirement twice now, and in real Vermont fashion, he was able to help other communities. We know how much he cares about Vermonters, our health, improving lives, and we recognize how much time and energy he's put into the community. So this recognition is well-deserved, and I want to thank Tom for his service and dedication to Rutland Regional. Last spring, I was part of the groundbreaking ceremony. In fact, I literally broke ground in an excavator, which happened because someone left the keys in it. That led to me giving a doc a quick lesson in how to run it. And in return, he was going to give me a tutorial in knee replacement surgery. Thankfully, that didn't work out. But that groundbreaking was the start of this $24 million project for the hospital and the greater Rutland community. This new building will allow for better access to care and will be more convenient for patients. With more space and the co-location of these practices, the hospital can move toward value-based specialty care, which is so important to the future of healthcare in Vermont. Congratulations to all. This state-of-the-art facility will help Rutland Regional meet the healthcare needs of the community for many years to come.
And now to close our presentation is someone who needs no introduction, as he now has his own building named after him. I'd like to introduce Tom Hubner, our former president and CEO.
I'm so pleased to be standing here in the new medical office building. You know, I used to say that at Rutland Regional, we listen, we respect, we care always. And part of that respect and part of that care is having great facilities for our patients. For so many years, our orthopods, physiatrists, ENT surgeons, and all the staff worked in really close quarters, space that didn't really work for our patients. So we had a dream to create this new building, and here it is, that dream realized. I'm so happy for our patients, for our providers, for our staff, that this day has come and we are here taking care of patients in this new building. When I retired 2.5 years ago, it was of course bittersweet. But one of the most touching moments, one of the moments that took my breath away, was when the board of directors decided to name this building after me. I kind of feel weird about that, to be honest with you. It feels sort of inappropriate. But it's an honor that I accepted, and I do truly, truly appreciate. I'm so glad that this building is here, that for years to come, we'll be providing such great care for our patients. Thank you so much to the board. Thank you to our staff. Thank you to our doctors and other providers for the care you provide every day. It is so appreciated by our community. Thank you.